Okay, I think we're live. Okay, hello everybody. If you're watching, welcome to our live with for ROAR for our nonprofit called ROAR for LTC. It's for long-term care, and ROAR stands for Respect, Oversight, Advocacy, and Reform for Long-Term Care, which is nursing homes and assisted livings, rehab centers, and skilled nursing facilities as well. So it throws a wide umbrella. And I am the writer, producer, and director of the documentary No Country for Old People, Nursing Home Expose. And it's on Amazon. And it really talks about this crisis in our nursing home and long-term care system that's been going on for over 5 decades. And it hasn't gotten better. And it is only getting exponentially worse. And that's why after the documentary, we decided to start a nonprofit, the ROAR, so that we could really educate the public, because I think all of us that end up becoming advocates or have been through some kind of tragedy in this long-term care system had no idea it was coming. So I think that the power of the people, as they say, is greater than the people in power, and that's really what it comes down to. And so we decided to organize a national walk. It's the first ever national walk for long-term care reform on September 27th, which is the same day as the brand new day of National Day, which is the National Long-Term Care Reform Day. So this is the inaugural walk to launch that day. And I'm really excited about it. We really wanted to, with lofty goals, to go out and get 50 states represented. And right now we have half the country. We have 25 states, and we are not stopping until we get representation in all the states. And again, the walk is on the 27th of September. So you can find out all about it. There's a QR code on your screen, or you can go to ROAR, the number 4, ltc.org, and find out more about it. We need volunteers, we need walkers, we need people to organize, we need people to help amplify the message so that the public can be empowered and become, the vehicle of change. So I'm going to introduce 2 of our walk leaders. I have Irma Rappaport, who is from Connecticut, and Robert Stewart from Delaware, who's representing Delaware. And so Irma, since I'm old-fashioned, I'll start with the woman first and say, why don't you say hello and just give a little short story of how you got here and why you are such a staunch advocate for long-term care reform.
Thank you very much. I'd like to say, as you see underneath my name, it says I'm the National Advocate for the Essential Caregivers Act. That's federal legislation that is one little piece of long-term care reform, but it's an important piece because families are so important to people in long-term care. Any of us here know that we have been inside these facilities alongside the staff and have been essential help and care partners to those staff people. And then my advocacy comes from COVID, what happened when I was locked out for 11 months. So I met Susie through this advocacy. She has been so helpful with the bill. She helped us create with her team a 30-minute video called 50 States, 50 Stories, where one person, I feel the same way as you, Susie, about wanting every one of the 50 states to be represented. And so we have one person in each of the 50 states telling their story for about 30 seconds about their experience during COVID. And one thing I think that this walk, what I'm just thinking is that every little bit of advocacy for change makes a difference because it builds up like a pile of blocks. And so the video, we have a petition, you have the No Country for Old People. Everything that you've done, Susie, builds up to make change. And I'm so glad to be a part of it with this walk. It's really so simple. you're not asking for, you're asking for anything that can be a walk. And in my state of Connecticut, I have 2 leaders helping me, and Susie helped me with finding those leaders. So once any one of the states that doesn't have somebody in that state helping with a walk, Susie will, once you say yes, I'll do it, Susie will be right there with you to help you. And as far as where to do the walk, it doesn't have to be any fancy place. It has to be a place that welcomes you. And I found, we haven't finalized anything yet, but I found a community center in my town where they have big country fairs and carnivals, and an indoor facility, a flat track to walk around so that people in wheelchairs are welcome, a gazebo where people can speak that has a wheelchair ramp, because we want residents and the legislators and advocates to be all welcome. And so I think a community center is a great place to have it. And of course, I really hope that you'll get some celebrities, Susie, from where you are to join that.
Well, we have, I'm hoping to get Jane Fonda, who endorsed our documentary, and also Lily Tomlin and Lisa Gibbons, hoping that, one of them will step up and say something. But I also have some other very good speakers who are very powerful and come with a really strong message. And I think, that it really I think if our goal is not to be political. It's really to be a community and to engage with the public at large who don't know. And it's really the power of the public. Again, it really is, because this is a year of our vote. We need to vote, and we need to do our homework and vote the right representatives in, so that this large lobby that is stopping us from using the kind of power that we normally have with policy change and legislation, we are being stopped by this large lobby. And if you watch No Country for Old People, you'll learn what the business model is and why it's so difficult to get any kind of policy, change or adopted. And then if you are lucky to do that, how is it enforced? Where's the oversight? How is it managed? Then it's really a difficult situation, because the system's been gamed. And the truth is that this is an equal opportunity crisis, because we all, God willing, get older. And at some point we are going to need some health care, and when we're going to be vulnerable, and you do not want to be in this system the way it is right now. Right. So thank you for saying all that, Irma. And I just want to say, in terms of just to underline what was happening during COVID, which really, it's no different than any other time. It's just that it pulled the curtain back so it was visible, right? And so we find out that 200,000 nursing home residents died the first year during COVID, during the lockdown, not because they had COVID, but because they had failure to thrive. It was from being isolated. That's a huge number. That's a number that's like a war. And you think about that number, and people write it off because they're older. They're older people. They're devalued. Well, until you're in that situation with someone you love or yourself, and you realize how precious life is, then you can't have that frame of mind. You just can't. That is such a removed frame of mind, right?
Right. And the stories are important, and that's what you say as well.
Yes. And so, Robert Stewart was a part of our documentary, and his story, family story, is so powerful. Like, I was sent your story.
I remember it was just so heartbreaking, and I'm so sorry.
Yeah, I still can't watch it without tearing up. And your family is so lovely. You were such great caregivers, but to your mom, and stories like yours, I get the gooses right now, because it's just so unnecessary. But Robert, tell your story a little bit and just say why it brought you to here, because a lot of people can't advocate after this happens to their loved ones. A lot of people say, how can you do this? Don't you just want to get like just get out of it. You've been in this hell for so long. So talk about that.
But before I tell that, I just want to piggyback on some things you guys were talking about, why I'm doing this and why it affects not only me, but everybody. Because I think there's like 23.6 million caregivers in the United States today. So that means that there are at least 23 million or more people that need to be cared for.
Mm-hmm.
And I am part towards the end of the baby boomer generation. And we are the largest segment of the population that is now in retirement age. And the caregiving population is less than the people that need the care. And if you don't think this is affecting you or it hasn't affected you yet, it will affect you. There's going to be somebody in your immediate family or purview or your extended family that is going to need care. And you are going to have to be a caregiver. And that sandwich generation that we know, if you have an ailing child or even just children that you're taking care of, you might also at the same time have the opportunity to have to take care of an elder loved one. And the state that I'm in, Delaware, is the poster child of this movement. There's 22,000 almost and a half people that need care in Delaware. And Delaware, a couple years ago when I got into this, was ranked the #1 state where people want to retire because there's no sales tax. And the lower part of the state has the beaches and the retirement villages where the people come to retire. And that we have an inordinate share of older people in this state. So we're like the poster child for this kind of stuff. And at the time, when my family was doing caregiving for our mother, who was suffering from dementia for 5 years, keeping her in her home. And we tried to take care of her in her home to keep her in that environment until that ungodly decision where she just can't be in there any longer. And paying for caregivers to come in at the times when we were all working at the time. So we had to make that ungodly decision to put her in a skilled nursing facility, a small one that we thought she would be better in terms of socializing and get to meet and have the consistent care of the people that was there, and she'd get to know somebody. But 18 months into her stay, she wandered away from the facility. And according to who you spoke to, because there was only 2 people in the memory care ward that was on duty, they either recognized she was missing 30 minutes after she missing or 2 hours after she was missing. So once they recognized that, they put together this haphazard search of the facility and the neighborhood. And after an hour and a half of doing that, they finally called the family and emergency services. Once the police arrived, they found her outside on the premises of the facility, deceased. And she was in a fenced-in enclosure. And right up over top of the fenced-in enclosure was a 3rd floor balcony off of the memory care ward. And come to find out that she wandered away out onto the balcony, unaware of by the staff or anything. And she fell off of that balcony. And based on her injuries, my mother crushed her pelvis, broke her pelvis, and she died from a hemorrhage from her bones sticking into her bladder. Ugh. But that's every time I get the opportunity to tell the story, I tell it. And if you look at No Country for Old People, you'll see we were in the midst of the grief, and it was very difficult for me to. But for some reason, something in there, I would tell the story, and I could tell that it moves people not only emotionally, but it gives them the impetus to say that there is something that needs to be done here. And I think that that's what is so important about the Roar, because we're demanding it's grassroots. It's people that have personal experiences in the industry. It's the caregivers that have cared for people in the communities. It's the workers in the industry that they don't have the sufficient environment to do the person-centered quality care that is needed of the people. It's the grassroots people that need to come together and tell their stories to demand the change that is actually needed, because
Right.
Susie mentioned the industry is fighting against the actual care, quality center care that is actually needed for the individuals that had to take part of the services that are offered by this industry out here.
And it's not getting better. When we first started the documentary 4 years ago, it's only gotten worse. And the corporate and investment, contingency has really grown exponentially. And because it is a very easy way to make $1 billion, because there is the oversight and the enforcement on these kinds of regulations. That we have good regulations, by the way. CMS, the Centers for Medicare and Medicaid, have very, they are put the regulations that they had created back in 1987 on the new Nursing Home Act Reform Act was studied. There was so much research put into it, and everything, they didn't leave anything unturned, but nothing is really adhered to, and that's the problem. So it's not about so for me, all the policies that we're fighting for is to put the Band-Aid on what's underneath. Because if they would just enforce the regulations that are there, that we wouldn't have to be having, the Essential Caregivers Act, because there wouldn't be a need for it. And there wouldn't have to have, cameras in rooms and, people getting raped when they shouldn't be because we're understaffed, and people wouldn't be chemically restrained because they wouldn't be understaffed. And that's the problem, is the understaffing. And the understaffing is because
that was in the Connecticut newspaper this week, actually, about understaffing. And then there's debate. Some facilities claim their staffing is fine, and there were quotes in it from a Ray Painter, Connecticut long-term care ombudsman, saying yes, there are issues, of course. And so newspaper articles keep shining a light on issues, and this walk will shine a light. And I just want to say also the co-leaders, Elon Caspi and Phyllis Amon, I thank them. And I also want to say that I'm on the steering committee of the Moving Forward Coalition that's headed by Alice Bonner. And very important, that the work that they're doing. They're on phase 3, I believe, now of the work they're doing. And they are trying to get CNAs engaged in the conversation, which is something that hasn't really been done in the past. CNAs are even though they may be the lowest paid of the administration in nursing home care, and assisted livings, they are the ones who are doing most of the share of the work. And so they should be part of the conversation.
Exactly.
But they're not, because that's what happens when you cut the budget, and it's not being cut by the system, it's being cut by the people that have gamed the system. So what happens is you've got people that can't work. Our frontline those providers cannot work and in a way that they want to work. And they go home with moral injury because they realize they're trying to take care of 20 to 30 residents in a day, and they cannot do that. They cannot do that. They're set up to fail. And that's the biggest problem. And if we don't stop that, the problem will continue. And the way we look at it is that it's going to take the public pressure. It's going to take us as a public, as a collective, to really demand the change. And it can happen. That's how any change has ever been made, is not from the top down. When it's from the bottom up. And so it takes a lot of manpower, as you can see by my stuttering, because I get like 3 to 4 hours of sleep a night since we started this. It's a lot of work, but my passion is so, it is indelible. I will not let up on this, because I know that it's really that we have to demand the change. We have to, because they're not going to. They will try to stop any kind of change at at any cost. And believe me, they have bags of money, as my partner Rick Moncastle will say, and a former federal prosecutor. And if anyone knows, he does.
Yep, it's a for-profit industry, and their business is set up to insure themselves up, and the cost of doing business is their insurance and paying the monetary fine, and then go on with their business. That's their whole, and they force the families who are in the grief stage from their loved one being killed at the hands of neglect, poor staffing, unsupervised care, to shoulder the financial burden of getting some kind of relief in the judicial system. And then they use their money to fight you in the judicial system. It's the cost of doing business.
That's right. It's written in. It's written in. It's into the business plan. Absolutely. There isn't one stone that they left unturned. I just met with a investigative reporter for who just did a big story on Ensign, which is another big corporate, diabolical organization that is, coming, like taking over on a lot of different states. And but the thing is everything that they're reporting is no different than what we reported in No Country for Old People, because it's the same. It's the same of the same. There's not, and it continues. That's why I'm saying it's getting exponentially bigger. Right. And the longer we wait, it's like it's already out of control.
It is.
But we need to take as much power back that we can. And as long as we're still a democratic country, we have our constituency, and that is our power to make changes. But it's going to take homework. You have to look at who's running. You have to question them and query them. What's their stand on, long-term care for the most vulnerable, not just elders. We're talking about people that have disabilities, who have, that are lifelong, and they need 24/7 care. Yeah. They suffer just as much, maybe more, because they have a voice.
Right. That when you guys are talking about the staffing ratio, I always think that resident to what do they call it? The caregivers or the administrator to resident staffing ratio that they're required by law to meet. A lot of them aren't even meeting that. On the month that my mother passed away, when the oversight agency went down to do the survey on her incident, they dinged them for being below that ratio hour 2 days in that month. And they were just halfway in the month. They had violated being below that. But I think that's a vague and a false thing that most caregivers and families shouldn't go by. Those facilities need to staff according to the residents' needs that they bring into the facility. They might have people there that have severe acuities. They need to ramp up to take care of the people that they're admitting into the facility, and not go by that vague hours per, each resident thing.
Charlene Harrington, who's from the University of San Francisco, who's been doing that research on staffing for the past 3 decades, she talks about that and talks about the different levels of acuity, and how it's not a one size fits all. Correct. Even if there were, like just what you're saying, I'm validating what you're saying, because even if they were to come close to the minimum staffing, it doesn't take into account the different levels of acuity. Exactly. And people aren't trained. So, their turnover for the certified nursing assistants is outrageous. And they think on that because it's cheaper. Exactly. They don't pay, they really don't give, they have less, they get less schooling than a manicurist. Exactly. They're trained less hours than a manicurist. And that's the fact. And so you have these people that they maybe have a good heart, but they're just trying to make a living, or not even close to a living. They're trying to, pay some bills. Yep. And people that are living in a facility that it is their home. It's their home.
Exactly.
and they need more than just someone bringing them, blood pressure test and some oxygen and maybe some water and some food. They need interaction. You
Exactly.
can't do that when you're understaffed.
Yes.
You're
Yep.
not.
Yeah.
It's impossible.
Yeah.
I think the law here is like 3.4 hours per day that each resident needs to be personal interaction with something. And I know that my mother wasn't getting that 3 hours of care each day for her own. And it's not because they didn't want to give it to her. It's because the environment and how it is set up. There's only 2 people for 15 people in the memory care ward all day in the facility where she was. And because of my mother's acuity, that wasn't as bad as any of the others, because she could feed herself, dress herself, walk, go to the bathroom on her own.
It was a dream. She was a dream for them.
Exactly. And they took her for granted. My wife always used that term, and I said, that is exactly right. They took her for granted. And because they needed to give the others, they took away her 3 hours and gave it to the others and let her be.
Right.
Yeah.
How unfair and how horrible, how tragic.
All because the facility would only put 2 people up there.
Right.
Because they could get away with it, because they could. And that's one of the things my family and I were, I guess, uneducated about, because it was a small facility, which we wanted. Didn't want her to get lost in a big institutional facility, but they had people that worked there for 10, 15, 20 years. And we're like, okay, she's going to get the know. But those were the administrators and the RNs and the staff, the people that do the hands-on hand every day. They were contract people, and the turnover rate was that. So she was seeing different people every single day. And for people in the memory care ward, that's
the worst you can do. You need consistency.
Exactly.
Yeah. Well, I don't know who's watching, if anyone's watching, but if you're watching this one, it's not live, just really know that this problem is not going to go away without us, it really is going to take the public, and it's going to take all of us to shift our perspective and our consciousness of how we think about aging, how we think about the value of people that are disabled, that are vulnerable, what we do as a society, and get back to being a community, because we need, we can't let our administration and the government take care of it. They're not going to do it. I promise you, they're not. Yeah. It's going to take all of us. So I cannot implore you enough to help us get the word, amplify our message, bring awareness to everybody, talk about it, bring it into the conversation. I know it's not sexy, but it's not. No one wants to talk about, nursing homes and dying and getting old.
There's children living in these facilities too.
We have to think about it. We have to. And, it's just important. We need to take care of our own, and we're not doing it. We're failing miserably. We're failing. And when I tell you, I'm not, a conspiracy theorist at all, or, and I'm not, I don't like to be inflammatory, but when I tell you these people are being tortured, they're being tortured. They're suffering right now as we're talking. They're suffering right now. And I think about it. That's why every time I think I'm so tired, I want to not do this. I need to just I'm tired. And I think, no, there's people suffering right now. And I only know it because my mom did it. She suffered, and your mom, both of your mothers suffered needlessly.
Yeah.
Needlessly. Yeah. So I guess if there's, I don't even know. This is our first live, so I don't see any questions. So we're going to have to get better at this, I guess. But if you're watching, I'm just going to let Irma and Robert, give your last words, and then we'll sign off, and then we'll hope that we get like 1,000 more signups. Please go to roar4ltc.org.
Yeah. I just want to say in closing, the long-term care isn't just about the people that are in the nursing homes today. It's about us, as you were saying, Susie. It's about us, because not only our loved ones, I'm doing this out of honoring my mother, but it's about your loved ones, everybody that may be watching, their loved ones that are going to be going into the system, or that people are going to have to care for, not only in the long-term care facilities, but needing help in your community or in your home to take care of your loved ones. I and my siblings took care of my mother for 5 years before she finally went into nursing home. And I'm telling you, you need support from the community.
Yep.
Yeah. You're going to need financial support. You're going to need emotional support. You're going to need it to be able to survive doing it. Or you're going to have to drastically rearrange your life to do the work that is needed to take care of a loved one that needs 24/7.
Exactly. Irma.
I think that I'm thinking about, first of all, anybody that's watching this who hasn't watched No Country for Old People, Susie's documentary from last year, I want them to watch it. And especially the end, there's experts on there. There's real life stories like Robert's, people that I know on there. And the very end tries to talk about how things could be better and what kind of advocates, what they're doing to try to make positive change. And that's just a step in the right direction, but you get the sense that there's an awful lot of work that has to be done to make that happen. And there are organizations that are working on it, including the one I just mentioned before. But I want to say to watch that and watch My Mom and the Girl that you did, because it tells you also why Susie, it gives you a real sense of what she went through, trying to struggle not to keep her mother at home. And I did the same. And I also want to thank the legislators who support. Where would we be without the legislators, the individual legislators who do support positive change, including the Essential Caregivers Act? You know, Connecticut, all of the legislators support the Essential Caregivers Act in Connecticut. And in Delaware, I don't know if you know that, Robert, both senators and the representative support the bill.
Yeah.
And it's compassionate staffers too that we've spoken with that spoke to the legislator and got them to support it. So anybody, you know, not only do we need to have all the steps I was talking about to make positive change, all the people in those, wherever in the organizations, in the industry organizations, getting any kind of support from individual people in those organizations, any kind of support from people in the legislative offices will build on.
Right. And they need the public. They can, you know, if it's one or two, you know, legislatures who are in,
I call it an army, right?
They need the army. They need the public behind them. They need they need us to vote in like-minded, you know, politicians and political voices that will support this, because if we don't change it now, our children will inherit this problem. And it's not going away. They will inherit it. That's a fact. So we're going to keep bringing stories of other advocates that are walking with us, because everybody has a different story, but it all ends up the same, right? And it's not a good ending, and you don't want to go through what we've gone through. And so, you know, go to our website, roar4ltc.org. And, you know, you can join as a volunteer. You can help us as a volunteer. You can help us walk. You can help join a walk that's already organizing and just be a part of that walk, or you can organize your own walk in your state that we need. And all that information is there. And I am an open book. If you want to get a hold of me, I'm at Susie@roar4ltc.org. You can reach out to me. I may respond at 3 a.m, but that's how it goes now. So until the next one, I really appreciate everybody who did show up, or if you didn't show up but you're watching it later, we love you too. And let's all roar together. Thank you.
Roar. You know, there's a yoga pose. We should start. There's a yoga pose called the lion pose.
The lion
That I-
roar.
You seen? Yeah.